Good morning, good afternoon, and good evening. Welcome to today's Grand Bargain Cash Workstream subgroup webinar, which is going to focus on connecting child protection, social protection, and humanitarian cash, working together to protect children from the effects of COVID-19 and beyond. My name is Lois Austin, and I work with the Grand Bargain Cash subgroup on linking humanitarian cash and social protection. We're going to start our webinar today with the usual poll that we do, just to try and give us an idea of who is going to be participating. This will help our speakers us to better interpret the feedback from the breakout sessions that we planned for later. The poll is going to be split into two this time. And the first thing that we are going to ask, as you can see on your screens, is which sector you're most closely associated with. There's a range there. I can see you're filling it in. So child protection, social protection, education, health, WASH, nutrition, food security, livelihoods and economic strengthening, protection, shelter, none of the above, and a cross-section of the above. So we'll just let that run for a little bit more. So we have predominantly people putting themselves in the child protection sector, so about 39%, social protection 30%, education 5%, nobody specifically for health and WASH, food security, livelihoods and economic strengthening, we've got 6%, 16% are a cross-section and 5% are none of the above. And then you've already moved on to the context where you're primarily working. So we've got the majority are working in humanitarian settings, 33% with 28% in development and 33% working in both, with a small percentage working in neither humanitarian or development settings. So just to give a bit of background before we get into the substance of today's discussion, this subgroup is co-led by UNICEF, the IFRC and FCDO. And part of the work of the subgroup is to reinforce dialogue and knowledge sharing between humanitarian and development stakeholders to support the linking of humanitarian cash and social protection in times of crisis. This area of work is led and funded by UNICEF, the knowledge management aspect of it, and it also encompasses the distribution of a fortnightly newsletter and some soon-to-be published case studies, which have been developed using contributions from members of the subgroup who are also central to the research and drafting in the case studies process. Today's webinar, which is the first of the year for the subgroup, will provide the opportunity to hear from 5 expert speakers who are going to share with us critical factors and experience in relation to linking child protection, social protection, and humanitarian cash transfers. Following their presentations, we'll be asking participants to join breakout rooms, which will be randomly assigned, and respond to some specific questions which are linked to recommendations of a recent policy paper, which you'll find in the chat box, published by the Alliance for Child Protection and Humanitarian Action, Save the Children, and UNICEF. The paper puts forward some robust arguments on why and how to leverage social protection towards child protection outcomes, which are relevant both to government social protection systems as well as humanitarian cash assistance. I'm going to hand over now to Laura Lee, who's going to facilitate this event. She's the co-lead of the COVID-19 focal point team for the Alliance for Child Protection and Humanitarian Action. Laura has more than 15 years of experience in strengthening global child, adolescent and youth health programming and protection and services in adversity settings. She will explain to you how the event's going to run, including when we get to the breakout sessions. She'll lead you through those. I would encourage you, please, to send any questions you have for the experts, put them to the chat box. We only have an hour, so hopefully we will manage to answer some of them, but those that we don't get to, we will respond to in writing, and we'll put that up on the sp.org webpage within the next couple of weeks. If you wanted to address a question to a specific expert speaker, then please state that, and if you can, say your name and the organization you come from. So I'm going to hand over now to Laura to start with introducing our speakers. Thank you. Over to you, Laura.
Thank you, Lois. It's a privilege to be with you all today and to be among experts in the child protection, social protection, and cash transfer fields. We're all here today because we care about what is happening to the world's children as a result of COVID-19. While COVID-19 and associated containment measures are really exacerbating root causes of some of the biggest threats to child survivor and well-being, social protection, including cash transfer and other innovations, have been shown to have protective potential for children. So today we'll hear from humanitarian and social protection actors as they share their experience in linking child protection approaches with humanitarian cash interventions and social protection. I'll now introduce the 5 speakers who will then continue with their presentations before we go into breakout rooms to discuss some of the challenges and opportunities to implementing the recommendations in linking child protection and social protection. The first speaker is Hani Mansourian, who's the coordinator of the co-coordinator at the Alliance for Child Protection in Humanitarian Action. Over the past 20 years, Hani has worked across Africa, the Middle East, and Asia in a variety of roles focusing on protection and well-being of children affected by crisis and conflict. The second speaker is Dr. Kathryn Taetzsch, and she's the Global Director of Humanitarian Cash and Voucher-Based Programming at World Vision International. Kathryn has 20 years of strategic and operational humanitarian response and academic research experience in fragile conflict and natural disaster-affected contexts. Key areas of her interests are shock-responsive social protection, the role of cash and voucher programming as an enabler to strengthen the humanitarian development and peace nexus. The third speaker is Alison Sutton, the Global Director of Child Protection at Save the Children. Alison has over 30 years experience working in human rights, child rights, and labor rights fields, 20 of them based in Latin America. She previously worked for UNICEF, Amnesty International, Anti-Slavery International, with a particular focus from UNICEF in Brazil on child protection, child rights, and social protection systems. Our fourth speaker is Hushain Shakir, and he's the National Coordinator of Good Governance and Social Accountability at World Vision Bangladesh, where he's been for the last 3 years. He supported the World Vision Bangladesh evaluation and learning process of the Citizen Voice and Action project. He's convinced that aiming at sustainability of these interventions is only effective if community members can express their needs, understand processes and benefits of such innovations, and provide constructive feedback with duty bearers. Julia Grasset is a senior cash and market specialist, and she's our 5th speaker, and she's at Save the Children US. Since 2012, Julia has been working in different technical positions within Save the Children, focusing on cash voucher assistance, food security, and youth livelihoods in the Middle East, Africa, and Latin America. And she's been working on case studies that highlight the importance of integrating cash voucher assistance and child protection programming to maximize the impact on vulnerable migrant children. So I'll now hand it over to the first of our speakers, Hani Mansourian.
Thank you very much, Laura. I'm just going to try and share my screen, but while I do that, I just wanted to first of all say I'm honored to be here speaking to all of you guys and be among this distinguished panel, but also to thank the Grand Bargain Sub-Working Group for hosting this first webinar on the topic of the policy paper that we'll be discussing. We think it's a really important topic as evidenced by the fact that we coordinated the development of this policy paper primarily related to the impact of COVID-19, but not only. I mean, we have always, for many years, been holding this belief that social protection and child protection share very similar objectives and goals, and are mutually reinforcing. Therefore, if we collaborate and coordinate and integrate our work, we can achieve much more results for, in our case, for children, but also for their parents and caregivers. So when COVID-19 came, and as Laura mentioned, the impact on risk factors of child protection that we saw getting exacerbated in very large scale, a scale that we probably none of us has ever seen before. We thought that it's the right time to up our game in terms of advocacy of bringing these two sectors. And when I talk about social protection, I should always mention cash and cash plus in humanitarian settings as well. So if I miss saying that, it's not intentional. So social protection. This what I'm presenting to you is the summary that has also been shared with you in the chat. It's on our website. So it basically gives you a very succinct glimpse of what the content of the policy paper itself is. So one section talks about what social protection is. For those of you that are social protection or cash experts know this very well, but it's important to mention this because I want to highlight the similarities to what child protection does. Social protection is a set of policies and programs aimed at preventing or protecting all people against poverty, vulnerability, and social exclusion throughout their life course, with a particular emphasis towards vulnerable groups. Now, if you look at the definition of child protection, which is prevention of and response to abuse, neglect, exploitation, violence, and violence against children, you see that there is significant overlap in the core of what social protection is trying to achieve and what child protection is trying to achieve. And that kind of makes us natural allies. There has been a lot of effort in the past few years in bringing the element of child-sensitive social protection into the work of social protection and cash. We think lots of really good work in that area is being done, but we are very far from where we should be. This diagram shows, which is borrowed from a UNICEF document, shows what child-sensitive social protection means. We have laid out in the policy paper arguments of why we should bring the two sectors together. I'll highlight the three main ones that are mentioned in the policy paper. First of all, the emerging evidence indicates very strongly that social protection can offer a lot of support to child protection outcomes. So if you're intentional in our design and implementation of programs, we can achieve significant gains in terms of protection of children through social protection. There are clear synergies to be had from finding ways to link or integrate social protection and child protection mechanisms to deliver better results for children. So natural synergies exist, as you very well know. A lot of the time, cash programs or social protection programs are handled by the same ministry, for example, in many countries that also handles child protection. And consistently bringing together expertise from both sectors yields substantially better results for children. And the policy paper outlines the evidence behind these. We have outlined some of the examples of the evidence that is out there. Social protection measures such as cash transfers have been shown to address some of the different drivers of abuse, neglect, exploitation, and violence. And I think it's very important to link this back to what we said about what COVID is doing, that is really exacerbating those drivers. So if social protection and cash programming can help us address those drivers, we are going to reduce the incidence of child rights violations. Adjustments, another example of evidence is adjustments to employment guarantee schemes can really ensure that caregivers, especially women, do not have to either fall out of workforce or end up putting their children in unsafe care situations because they have to work. I'll skip the next one just for the sake of time, because I know I'm running out of time. There are 4 key recommendations that the policy paper provides, and we will invite you later in the webinar to go into groups to discuss these. So I think it's important to quickly mention them. So these are categories of recommendations. So there are multiple recommendations under each. One of them is in the area of financing, policy, and coordination. It suggests that we should include child protection components in social protection projects and finance expanded coverage in the recovery phase of COVID-19, particularly mapping and assessing joint policy and program landscape. Again, I won't go into detail. You will get a chance to read it and discuss it. Another category of recommendations is around program design and implementation. It talks about how we need to begin that collaboration across the 2 sectors from the early stages when we are assessing the situation and when we go into design and implementation of the project. Monitoring and evaluation, it's extremely important for us to monitor child protection outcomes, both negative and positive. Within social protection and cash programs, there are several examples of either social protection or cash programs having very positive child protection outcomes that if we don't measure, we won't know, and also negative. There are cases where social protection programs had to adjust their programming because they were having significantly negative impact either on women or children. So within monitoring and evaluation, making sure that we are intentional about measuring child protection elements is key. And lastly, but of course not least, is taking a systems-wide approach. It needs to be, these integrations and collaborations need to be systematic, needs to be done at the systems level for it to be sustainable and meaningful. And of course, there's a list of resources at the end of the policy paper. Again, I hope you guys read it and find it useful. I also want to quickly apologize because I will have to leave about at half point of the webinar, so I may not be with you during the Q&A. I apologize for that. I hand over back to Laura. Thank you very much.
Thank you very much, Hani. And I'll now hand it over to Kathryn.
Thank you so much. Now, as we've just heard from Hani, there is a very, very big scale up of social protection that we've all observed over the last probably 1 year or so in terms of COVID-19 response. As you may be able to see on the screen, World Bank has measured the interventions, and actually they have gone beyond 1,400 separate interventions that are scaled up in response to COVID-19 impact. This is data as of mid-December 2020. Now, as we can see, these bars going up, it's very important to notice that about 1/3 of those interventions are actually cash transfers, and they reached over 1.1 billion people globally, which is about 14% of the global population. This sounds very impressive given that pre-COVID levels, actually, we have seen that now in 2020, cash transfers actually doubled. And these social protection interventions grew by 240% on average. This is very, very impressive. We in World Vision also have seen a massive scale up of our cash interventions. We reached about 6.4 million people in contexts that are mostly fragile, and actually about 42% of those benefiting from those cash and voucher transfers were most vulnerable children. However, with all this said, it is very important also to understand that despite this massive scale up, there is still 2 out of 3 children globally that have not any access to any form of child or family benefits. And often the coverage of those social protection mechanisms is the lowest, where child poverty is the highest. So this means that we are, as humanitarians and development actors, really called to create pathways and find complementarities and synergy effects between humanitarian cash and voucher assistance, as well as longer-term government-led social protection mechanisms to ensure that even these longer-term vulnerabilities are also addressed. what we have clearly seen, and I may just reference here that obviously many of you know, in the State of the World's Cash report facilitated and published by CULP last year, there was a discussion point around there is need for change in power relations. How much do affected community members, how much do children and youth actually have the opportunity to put in or to complain or give feedback about a transfer system that is provided? Who is in the driver's seat? This also actually has highlighted that there is need for much more understanding among humanitarian cash transfer actors in particular to better grasp government legal and policy frameworks, understand who is eligible, who is included, who is excluded, and also to help ensure more equity in access and the provision of quality services that have child focus. With the overall commitment by many actors to support strengthening national social protection systems, in particular health and education, as we've seen, COVID has clearly illustrated how much there is sensitivity and fragility of those systems, even in advanced economies. There is a need to strengthen social benefits. Even there is a lot of discussion around universal child benefits. So one of the things we have seen practically at field level is often there's lack of who's the duty bearer for these transfer assistance schemes. Who needs to be held accountable, that they're really inclusive, that really children's needs are considered very strongly at the center front of our interventions. So we have seen in World Vision that a developmental approach actually is quite effective. We call it citizen voice in action, which is basically an approach of social accountability through civic education, through mini social audits, participatory services, scorecards, and community-led advocacy. And with this, over the years, we have seen massive, massive success in many countries. We're actually applying this approach in over 50 countries now. And we have seen, for example, in Tanzania, that the maternal child health budget of the government some years ago increased by 50% after these interventions were lodged and lobbied with multiple CSO and national government partners. We have also seen that, for example, child protection legislation was enabled and facilitated in Kosovo. So with this in mind, what does that mean then if we're looking at the challenges that COVID-19 has brought to us? We see, as the study for child protection and social protection clearly highlights, we see that there is a need to strengthen monitoring and evaluation systems, but we also do see that there is an importance around national system strengthening to create effectiveness and agility. So when social assistance scale-ups by government service providers do not yet reach the most vulnerable, then that means that humanitarian actors have to be faster, as they have in some contexts really proven, to step in that gap, but also to not only assist with cash and voucher transfers, as we, for example, have done with MPCA in Bangladesh. Between April and June last year, we serviced about 66,000 people, and about 26,000 of those were most vulnerable children benefiting. We also need to see that there is strengthening in referral systems and in community accountability feedback mechanisms to ensure that the most vulnerable are actually reached. You will hear from my colleague Hushain and Shakir in a few minutes about the successes we've had with the citizen voice and action approach, and we would actually really recommend that other actors also take up this kind of or similar approaches of social accountability to ensure child protection and social protection are effective and reach the most vulnerable children. I'm now handing over to Alison. Thank you.
Welcome, Alison. We look forward to hearing from you.
Oh, sorry, I'm just... So thank you, Kathryn and Laurie. Very happy to be here at this webinar organised by the Grand Bargain subgroup on linking humanitarian cash to social protection. The title of the subgroup says it all. We're all seeking ways to ensure sustainable social supports to address both economic and social vulnerabilities of children and families and their resilience to shocks. It's great to be among practitioners who are grappling with this in their program design and implementation across many contexts on a daily basis. Today, we're exploring with you and hopefully in rich practice-based discussions in the breakout rooms, reaching an optimal interface between child protection and social protection, From the previous speakers, we're clear on why this is a goal. Children urgently need sustainably financed social protection systems linked to properly resourced child protection services to address increases in violence, exploitation, abuse and neglect, increases in separation from families, in child labor, child marriage and trafficking that have lifelong impacts on children's health, learning and well-being. We have a growing body of evidence on the positive impacts of working closer together. What we need to share between us are the lessons on the how. Save the Children was happy to be involved in the development of the policy paper under discussion. A practical aspect I will touch on is on the setting and measurement of child protection outcomes from cash and social protection interventions. And Julia Grasset will develop this in the example from Colombia. So following on from Paul Harvey's interagency scoping study in 2019, the Cash and Child Protection Task Group of the Alliance for Child Protection Humanitarian Action has developed and piloted a monitoring and evaluation toolkit for use in cash and voucher assistance interventions. This involved a literature review, drafting, receiving inputs from a reference group and piloting. Due to COVID-19 and the limitations of travel, we received written feedback from Somalia and Nigeria, and the tool was piloted in Northwest Syria. There are 3 tools. The first 2 for use across all to direction. Third is specific to child protection case management colleagues who are engaged with and or supporting cash and voucher assistance programming. The aim of the tools is to close the gap, the evidence gap that currently exists in cash and voucher assistance and child protection programming by identifying child protection risks, identifying mitigation strategies, and monitoring child protection outcomes. It will be hot off the press next week in English and available in Spanish, Arabic, and French in March. Those interested can contact the Alliance and my colleague Julia Grasset, who will follow, also Lauren Murray, who from Save the Children, who is participating. So Julia will now present cash and voucher assistance case study from Colombia in the policy paper. But as an agency working in all contexts, Save the Children is also engaged in measuring the impact of a range of cash plus interventions in non-humanitarian contexts. We have seen promising results from the inclusion of parenting sessions, for example, in the Nepal Child Grant, which focused primarily on reducing malnutrition, but has seen increased bonding and reductions in violence against children. Such linking of parenting programs to social protection is also being taken up in Somalia, Zambia, and Burkina Faso with positive results. When we recently discussed the challenges facing us, a colleague posited that we should be working at a new frontier across all contexts, focused on children's social and psychological well-being, the need for which has been amply demonstrated in the context of the pandemic. Moving beyond siloed approach to basic system strengthening in healthcare, education, social protection, and child protection, which is still needed, that system building, but moving beyond the siloed approach to focus on the achievement of outcomes for children and the role of every sector in this. This requires better integration across the systems and with huge potential at community level. So I'm really pleased that Hushain is going to be following up with the community level perspective in the next, in a future intervention. But to get there, we need to focus on measurement and evidence. So we're hoping that you can all contribute to this discussion in the breakout session. Thank you. And I pass on now to Julia.
I'll first welcome Hushain and then followed by Julia. So Hushain, welcome.
Hello, can you hear me?
Yes.
Okay, thank you. So actually, the thing is that as my in my presentation, I would like to introduce one project and the project learnings from our Bangladesh perspective. So, as my colleague Kathryn said, that the citizen voice and action is the World Vision social accountability model, and this model facilitating a participatory accountability process among duty bearer and service receiver to create good governance and social accountability in public services. And that's really the project is been. So okay, so these are actually the projects. So in the project, the citizen voice and action approach mainstreamed. So this is a EU funded project and strengthen work in 9 social safety net scheme of Bangladesh government, and to strengthen the equitable access in social safety net services. So during the 3 years of the project team, with the support of local level CSOs, conduct 500 community scorecard session to hear from community satisfaction on the access and the service they received from the government, and conduct several face-to-face dialogue followed by the community discussion to strengthen the equitable access. So these are really the project when we evaluate the project. So though this is not really the project ended up before COVID-19, but our key learning was that this project minimized inclusion error in beneficiary selection process of targeted 9 social safety net project location, and access to social safety net information for communities increased to 83%, which is in the baseline or in the starting of the project, this is only 15%. So one of the major key intervention of the project is to inform and aware communities and citizens regarding their rights and entitlement, as they can raise their voice to the duty bearer to ensure equitable access to services. Civic education sessions is really helpful in that purpose. And the other is that the equitable access in the last row. So the equitable access to social safety net is strengthened 74% compared to 5% in the targeted community, which is really a very big achievement. And when we measure the satisfaction of the social safety net entitlement, we actually consider the 4 issues. One is transparency, one is ease of access to entertainment, fairness, and adequacy of social safety net cash allowance. And we found that at least a 20% increase in each element after when the project ended up. And finally, though the project focus was not the child protection directly, but we see during the evaluation that several contributions happens in child protection by default along with social protection, like early and child marriages, domestic violence, and school dropouts were reduced in the targeted community in the last 4 years. School dropout has reduced dramatically due to the economic empowerment of the 7775 vulnerable women due to their access to social safety nets. And finally, the ethnic people are aware, because the project concentrated area, there are a lot of ethnic peoples and ethnic minorities groups are there. So ethnic people are aware on the importance of the children's school enrollment. They discourage dropout and resist early marriage in their respective communities. So these are the by default effect that have been captured during in the child protection issues of social protection this project. So thank you.
Thank you very much, Hushain. I now welcome Julia.
Thank you so much. Hello, everybody. So I just want to take a little bit of time to tell you about our Colombia case study. So just a bit of background. This project is a multi-purpose cash transfers program integrated to child protection and nutrition that we have implemented back in 2018, 2019. As part of the Venezuela refugee response. So at the time, it was estimated that around 5,000 Venezuelans were crossing the border into Colombia on a daily basis. And needs assessments indicated that upon arrival, Venezuelans were highly vulnerable and were resorting to negative coping strategies in order to survive that were highly harmful, notably for children. So in order to respond to that, we set up this multi-purpose cash transfer, which aimed at covering their basic needs, but which was also integrated to child protection. So as part of child protection activities and the integration, what we've done was setting up a bilateral referrals, meaning that whenever our child protection teams were identifying that within their case management, there were families that were facing some risks that were very, very linked to economic causes, they would refer them to the cash team, and the cash team was trained as well to identify any potential signs of child protection risk and to refer them to our case management team. So the integration went a little bit further in the sense that we also developed what we now call a money management tool, which means that whenever a family was benefiting both from cash transfer and case management, the case manager would help the family thinking through how they would be using this cash transfer in the best interest of the child. So at the time, there was no real toolkit or guidance on how to measure the impact of cash transfers on child protection. So unfortunately, at the end of the program, we didn't have like indicators that were monitored properly since the beginning of the program, as we have for other sectors. However, through this case study, we did a qualitative analysis to try to capture what the impact has been. And so the finding of this was that cash transfer have really, really enabled families on various fronts. We have family reunion that was made possible through cash transfer. We have reduction of child labor, a reduction in risks of sexual violence. We also had some risks of recruitment by armed group that was also reduced thanks to cash transfer, physical violence as well as negligence. We did track a few indicators, including household reporting an improvement in households' relational dynamics thanks to the program, which was relatively high, as well as improved well-being in their children thanks to the cash program. So this is, I think, a very good example to show how cash can have an impact whenever designed properly and in an integrated manner on child protection outcomes. But also an example that we do need to better monitor what these outcomes are. And this is where all the interest of the child protection and cash monitoring toolkit that was developed as part of the Alliance work will hopefully be able to help in the future. As Alison mentioned, so this toolkit is currently has been piloted in Syria, is currently being piloted as well in Colombia, in Cambodia, in Peru, in Guatemala, as well as in Venezuela. Thank you very much.
Thank you very much, Julia. And to all the speakers, to Hani, Kathryn, Alison, Hushain, we really appreciate your insights. We're now going to move to a group activity, and if you can put up the slide, that would be great. But I'll describe it. So in your chat box, you'll receive a link to a Google document. You'll have 10 minutes in these groups. There'll be about 5 or 6 in your group. And please do engage with your group. It's a chance to engage with colleagues globally. You'll find a group number when you go into your group. Look at the instructions on the Google Doc, and this will tell you which set of recommendations, 1, 2, 3, or 4, to work on. Your instructions are to discuss both the challenges and opportunities to operationalizing these recommendations. After you've discussed these, you may summarize them as a group. Perhaps you choose 1 or 2 key challenges and opportunities. And in the last few minutes of the breakout session, you could choose 1 group member to follow your group's link to input your group's responses in a Mentimeter. This link is found in the instructions and is specific to your set of recommendations. So the questions are, what challenges can you foresee in implementing the recommendations from the brief, and what opportunities has your group identified in implementing the recommendations from the brief? If you have any challenges in your group, there's a button where you can call the host for help. Enjoy your discussions. Welcome back, everyone, and thank you for your participation in the breakout rooms. Hopefully some of you had fruitful discussions. I want to say we're launching another poll as people come back in, so please do fill that in. And please do feel free to add questions to the chat. If we don't get to them today, which is likely the case, we will post responses after the webinar. And we'll also post the results of your discussions, of the challenges and opportunities that you've discussed. And so here the results are coming in. Do you believe that social protection will benefit from more intentionally integrating child protection outcomes in their design and implementation? A fairly unanimous 91% yes, and a few who don't know. Do you believe child protection will benefit from integrating social protection elements in their design and implementation? An overwhelming yes. So we want to thank you again for your participation in the breakout rooms, and for your and to our speakers. We really we're grateful for your insights. I wonder if I should take one question, perhaps to Julie or Alison. With some governments doubling up on the cash transfer value during COVID-19. Actually, okay. Are there good examples, good practice with social protection and the impact of COVID-19 on children with disability? Sorry, for Alison or Julia, if one of you could take that question before we conclude.
Hi, Alison here. I'm not going to be able to answer that immediately like that. But we conducted a survey on the impact of COVID on children with over 25,000 children and families in 37 countries where they are program participants. And one of the most striking features was the impact of COVID on children with disabilities and caregivers with disabilities in relation to violence in the home, access to food, access to health service. I mean, it was stunning across the board. We did a specific study on that, pulling out that evidence, which I can send the link to. And what was the policy and program recommendations coming out from that? Just that it's behoven to all of us to make sure that the child protection, the social protection, the education outreach, all those interventions must much more intentionally seek out children with disabilities and children living in families with disabilities, because they are, they're excluded and they're suffering the most. So that would be, and then, we can generate some discussion about good practice on that.
Thank you very much, Alison. And we apologize that the time has gone so quickly and we're not able to answer all the questions, but please do follow the links to the resources in the chat box. The policy brief link, as well as the summary, was posted. Those will also be on the sp.org website, including the responses. We also want to thank again all of the speakers and all of the participants as well, particularly for your participation in the breakout rooms. And we do want to remind you as well to fill in the feedback in the chat box at the end of the webinar. A survey link will be posted. If you could fill in the survey, that would be really helpful. And we want to thank you all for your participation today. Now that we've all reflected on the challenges and opportunities of operationalizing these recommendations from the brief, we challenge you all, from whatever position you're in as a social protection actor, a child protection actor, a humanitarian or development context, to take these recommendations forward and do what you can to enhance the protection of children working together. Thank you very much, everyone. A reminder to fill out the survey, and we look forward to seeing you at the next webinar.